All right, then let's begin today's class. So we will come across the last subject today, that is microbiology. And today and tomorrow we will finish. Today we'll start with bacteria and fungi. Tomorrow we'll complete with protozoa and virus. Okay, along with antimicrobial. So let's just start. All right. So microbiology, one of the very high yield subject in the step one, and basically it's very easy. Okay, it's very easy, but it will be easy only after you have watched Sketchy. Okay, Sketchy Medical is very, very important if you want to retain the microbiology knowledge for a long period of time. Okay, maybe you might be doing some other resource and you are able to solve the questions correctly, then you don't need to go for Sketchy. But if you are confused and if you are doing the questions wrong again and again, and if you don't want to, if you haven't done any other resource, then I would highly recommend Sketchy. Is good for both microbiology, learning the bacteria, virus, fungi, everything along with antimicrobial. All right, so let's just begin. See, step one is not going to ask you the basic structures of bacteria, or particularly they are not going to talk to you about the gram stains and everything. All right, particularly they won't ask you, but in the question they will be giving you कि it was stained with this, so that becomes a hint for you. Okay, it's okay if you don't remember it from here along with the microbe, you will remember it, not an issue. Okay, तो उसमें कोई problem नहीं है. Just give it a read and read this at the end of completing micro. Okay, अभी starting से read मत करना, कुछ याद नहीं होगा, you won't be able to retain anything. Okay, so do it from the end. Okay, end से करना, so that it becomes a revision for you. All right, everything over here, just give it a read. Not at all important. They won't be asking you particularly about which stain is used to diagnose this bacteria or something like that. Okay, USMLE doesn't focus on this. All right, even the bacterial genetics, just give a read. Only one or two questions are there in UL. If you even do that, it's okay. Okay, general part of microbiology, just do the UL. You don't have to do anything else. Okay, it's just a waste of time. So UL में जितना दिया है कर लो. Apart from that, nothing else. All right. Yeah. Do this main features of oxytocin and endotoxin. Not important, but एक बार read जरूर कर लेना. Coming to bacteria with exotoxin, from here your actual microbiome starts. See, even this is about all that we will be doing along with the microbe, but what happens is sometimes they will ask you increase in protein synthesis, increase in fluid secretion, increase in phagocytic capability, increase release of neurotransmitter. Okay, Baki all this you have already done along with the microbe. So I'm not going to discuss that over here. But yeah, this is what they will ask you, and this is where you will be confused. You won't be knowing. Okay, you will be confused. कि ये कहाँ सा part है? ये तो हमने कहीं पढ़ा ही नहीं है. Alright, it's not like that. You have to look at all these functions also, mechanisms also. Okay, because you will be remembering this mechanism, but actually in the question they will be asking you this. So make sure you know both of them. Alright, moving ahead. Similar over here. Okay, and yeah, do this endotoxins का इसमें क्या relation है? Do this image. Okay, so let's just come to our first topic of microbiome. We will be starting with bacteriology and mycology, and if I get the time, I will finish parasitology also today. So let's just start. The first, we'll be starting with the gram positive, and see, do one thing. इस फ्लो चार्ट का फोटो निकाल के अपने सामने लगा दो. Take the printout of this photo and stick it in front of you, because what will happen is there are so many so many bacteria. You will remember each and every feature about each and every bacteria, but the problem will be when you will be studying it together. At that time, you will be difficult. It will be difficult to know whether coagulase positive वाला कौन सा था, यूरियस पॉजिटिव वाला कौन सा था, किसमें अल्फा हिमोलाइसिस है, किसमें बीटा हिमोलाइसिस है, what is having gamma hemolysis and everything. Okay, so make sure you know all of them, and in order to know that, this is the best summary I have ever seen in any of the book. Okay, this is the best. Catalase के related दिया है, gram positive दिया है, then you will have different types of hemolysis, then you will be have optocin bile, you will have bacitracin, you will have 6.5% NaCl test, you will be having no biocin test, you will be having coagulase positive or negative, everything you have given over here. Okay, so gram positive, let's just start. We'll start from yes, step or yes. Okay, so I will just tell you what all is important over here. Let's just start. Gram positive, catalase positive, beta hemolytic is positive, coagulase positive is important in clusters. Okay, protein A factor bind FcIgG, inhibiting complement activation in phagocytosis, commonly colonizes near ears axilla enzyme. Okay, causes. Causes you can avoid it, but remember one thing: pneumonia often after influenza virus infection. This is very high yield and very important. Okay, influenza virus के बाद if they ask you now what the patient is at risk of, so you will say it is at the risk of Staph aureus infection, Staph aureus pneumonia, very infection. Okay, and infective endocarditis, septic arthritis, osteomyelitis, toxic mediated toxic shock syndrome, TSSC1, Scarlet syndrome, exfoliated odds, all this stuff. So these are the causes of how Staph aureus will be affecting your body. Now MRSA, methicillin resistant Staph aureus, important cause of serious healthcare associated and community acquired infection. Now problem here will be resistance due to altered penicillin binding protein conferred by the MAC-A gene. Okay, some change release, this is not important. Okay, this is not important, but this one is important. MAC gene की वजह से है. And let's just see. TSST is a super antigen that binds to MHC class 2 and T cell receptor, resulting in polyclonal T cell activation and cytokine release. This is very important. Cephalococcus toxic shock syndrome. So see, they won't specifically give you features of a toxic shock syndrome. If they will give you all the features combined, and then you will have to figure out whether there is end organ failure or not. Okay, if there is end organ failure, enzymes will be released from all the organs. For example, in liver you have AST, ALT, gallbladder stability, associated something like that. They will be occurring. Associated with prolonged use of vaginal tampons or nasal packing, compared with Streptococcus pyogenes. Okay, Staph aureus food poisoning due to ingestion of preformed toxin. Short incubation period 2 to 6 hours, followed by non-bloody diarrhea and MSH. Enterotoxin is heat stable, not destroyed by cooking. Staph aureus makes coagulation toxin form fibrin clot around itself. So this is all what is given in the book. Now apart from this, how do you like to ask the question is 1 or 2 points, please write it down. Staph aureus ferments mannitol. Okay, this is important. Staph aureus ferments mannitol. Another thing, if in the question they are saying that the patient had mayonnaise based food stuff. Okay, so if mayonnaise is given and if due to mayonnaise there is a food poisoning, think about Staph aureus infection. Okay, another thing, the endocarditis that they have given over here, they will be mostly in the tricuspid valve. Very important. Please keep this in mind. Tricuspid valve. Okay. So this is all you have to remember. And yeah, see another thing. It is non-bloody diarrhea. Non-bloody diarrhea and the incubation period. They love to ask incubation period. I know it's difficult to remember all the incubation period, but they ask it, and so we have to be thoroughly remember. Okay. So 3 to 4 important points that I want you to remember in Staph aureus is tricuspid valve endocarditis, ferment menital, mayonnaise. All these other tests. That's how you will be diagnosing Staph aureus. And if you see this properly over here, you will be easily able to do. Okay. So catalase positive, coagulase positive, Staph aureus. All right. So I hope everything is clear over here. Just make sure uh, there is non-bloody diarrhea and 2 to 6 hours is the incubation time. Even this is important. The TSHC gene they will ask you. And for MRSA, it is associated with the MACA gene and hospital-acquired infection. That's all for step for you. Okay. Now coming to step epidermitis, gram positive, catalase positive, but it is coagulase negative. As we see here, it is coagulase negative. So coagulase negative, and we have two. So we will go further. If it is coagulase negative, urease positive. Okay. Novobiocin sensitive. Does not ferment mannitol. Okay. Normal microbiota of skin contaminates blood culture. In fact, prosthetic device. This is where you will be picking out. Prosthetic device is very important. If prosthetic device is given, straight away think for staph epidermitis and IV catheters. Prosthetic device and IV catheters. Okay, so how you will distinguish it from staph aureus? This the first of all the causes. The catheters and prosthetic device aren't seen in the staph aureus. Second, you get coagulase positive, but catalase positive, but it is coagulase negative. This is very important because staph aureus is both positive. And the important thing, it is urease positive, whereas staph aureus is not urease positive. Okay. Now coming to another type of staph species, and that is staph saprophyticus. Now see, both are coagulase negative, whereas catalase positive. But now what you will be looking for? You will be looking for novobiocin. If it is novobiocin sensitive, then it is going to be staph epidermitis, and if it is novobiocin resistant, then it is saprophyticus. Okay, so this you have to keep in mind, and that's why I've been telling you take the printout and stick it on the front of the wall, on the wall. Okay, so let's just see. Coagulase negative, urease positive, no biocin resistant. Normal microbiota of female genital tract and perineum. Second most common cause of uncomplicated UTI in young females. Most common is E. coli. Now see, if they want to talk about young female and UTI. The first option you should always go for E. coli as we saw in the renal system. Okay. But if they don't want to talk about E. coli, if they want to talk about the gram positive bacteria, then your thinking should directly go towards the Staphylococcus saprophyticus. Okay, so these are the differences between aureus, epidermitis, and saprophyticus. In Staph aureus, it will be the catalase positive, coagulase positive. In epidermitis and saprophyticus, both catalase positive and coagulase negative, both of them. Now, how to differentiate saprophyticus and epidermitis? You will be looking at novobiocin. Novobiocin sensitive in epidermitis, resistant in saprophyticus. And the important thing, Staph aureus and Staph epidermitis. Staph aureus ferments mannitol, whereas epidermitis does not ferment mannitol. Okay, so this is how you will be going for. And the important thing, here also you have to look out for endocarditis in artificial heart valve. Okay, so this is important. Artificial heart valves or catheters or any implant that they are talking about, think about staph epidermitis. All right. Let's move forward to the step physics, and we have Streptococcus pneumoniae. Please remember this image. This is most frequently asked image in the exam and BME you will everywhere. So let's just see what we have over here. So for Streptococcus, it is catalase negative. Now let's see what we have over here. It is optocin sensitive and bile solubility. If it is positive, it will go towards pneumonia, and if it is negative, it will go towards mutants and metis, which will be doing virulent streptococci. Okay, so let's just see first Virens, and Streptococcus pneumoniae. First, alpha hemolytic lancet shaped is very important. Diplococci is very important because in the question most often they will say gram positive diplococci. Okay, gram positive diplococci is Streptococcus pneumoniae, but gram negative diplococci is Neisseria. Please keep this in mind. Okay, gram positive diplococci, gram negative diplococci. This is how you will be distinguishing. Okay, this is very important. Diplococci is very high yield. See, you can see. All right. Encapsulated IgA protease, optocin sensitive and bile soluble. This is what is high yield. Optocin sensitive and bile soluble. The most common cause of is MOP, meningitis, otitis media, pneumonia, sinusitis. Pneumococcus is associated with rusty sputum. Rusty sputum will be there. Okay. So rusty sputum will be given in the question. So along with rusty sputum, they will give you gram-positive diplococci or lancet-shaped bacteria or optocin sensitive and bile soluble. Okay. What apart from this? Yeah, in vaccines against Streptococcus pneumonia for adults, the vaccines act against vaccines that we have is IgM vaccine, whereas for child we have IgG vaccine. All right. So that's it for the Streptococcus pneumoniae. Let's move on to the virulent group Streptococci. So for virulent group Streptococci, again everything is going to be same, but only one difference is optocin resistant and bile insoluble. This is how you will be differential diagnosis between virulent Streptococci and Streptococcus pneumoniae. ओके ओरोफेरिंक्स का नॉर्मल है ये स्ट्रेप्टोकोकस म्यूटेंस एंड माइटिस कॉज डेंटल कैरीज वेरी इंपॉर्टेंट दे आर फ्रीक्वेंटली आस्क्ड स्ट्रेप्टोकोकस sanguinis makes dextrins that bind to fibrin platelet aggregates on damaged heart valve causing infective endocarditis very important okay if virulent streptococci are there in that also there are two species mutants and sanguinis if it is sanguinis think about damaged heart valve damaged heart valve very important. Whereas Staph aureus is going to act on the fresh heart valve, and on artificial heart valve, Staph epidermidis. Whereas it is given damage, think about virulent streptococci, and about dental procedures, think about mutant. Virulent group Staph lives in mouth because they are not afraid of skin. This is how you will be remembering. Okay. So I think that's it for Biden group streptococci. All right. See, there are basic small differences, and believe me, if you have watched the sketchy, this is going to be a smooth ride for you. All right. Coming to Streptococcus pyogenes, group A streptococci. Now, what is over here? This is very high yield, and so many questions have been asked from here. So let's just see. Gram-positive cocci in chains. It may be pyogenic, it may be toxigenic, it may be immunogenic. So there are all the conditions that you have to remember. Okay, they will be asking you what is the mode of infection in pharyngitis in caused by Streptococcus pyogenes. So you should know it's pyogenic or scarlet fever, anything. So it is because of the toxin, and rheumatic fever is because of the immunologic condition. Okay, and yeah, in the question they might give you the honey crusted lesion. So honey crusted lesions is what impetigo. All right. I mean, bacitracin sensitive beta hemolytic, pyrrolidonyl amide PYR positive. Okay, so let's just come back and see over here what we have. Bacitracin sensitive and PYR status. So if it is positive, it is group A pyogenesis. If it is negative, it is group B step galactica that is mostly seen in babies. Okay, so let's just come to group A. So just try to remember the mechanism behind the disease and bacillation sensitive and PYR positive. Hyaluronic acid capsule and M protein inhibits phagocytosis. Very important and high yield. Very important high yield. Okay. Antibodies to M protein enhance host defense against staph pyogenes but can give rise to rheumatic fever. This another line is very important. In UL, there are two questions asking for this line. Okay. Diagnose strep pharyngitis via throat swab, which can be tested with antigen detection assay or culture on blood iron. They won't ask you about this. Let's come whatever given over here. Pharyngitis can result in rheumatic fever and glomerulonephritis. We have seen the glomerulonephritis, PSGN. So they will confuse you with the PSGN diagnosis. At the end, they will ask you what type of species was responsible for this. So don't confuse. Strains causing impetigo can induce glomerulonephritis. We saw if there was a skin rash problem or there was a throat pharyngitis problem. So both of them can be associated with PSGN. Key virulence factors include DNA, erythrogenic exotoxin, streptokinase, streptolysine O. ASO titer or anti-DNA ZB antibodies indicate risk and prep pyogenesis infection, and this is the most commonly asked question in UL as well as in NBME. So make sure you know all the antibodies. This bacteria is very, very important, and for sure they are going to ask you. Coming to scarlet fever, what is scarlet fever? Blanching, sandpaper-like body, strawberry tongue, circumferential pallor in the setting of group A stem. So what you need to remember here is think about the sandpaper-like body in the question and strawberry tongue. Okay, strawberry tongue and sandpaper-like product. So this is all that is very, very important. And apart from this, I think yeah, we saw the group A streptococcus infection in the rheumatic fever. Okay, so for rheumatic fever, you must be knowing what criteria is used. What criteria is used? Yes, you are correct. Jones criteria is used. Okay, Jones criteria. So you should look for the Jones criteria also. Joint, heart, subcutaneous nodules, erythema, marginatum, and Sydenham chorea. We have discussed this in the cardiology section while we were doing the rheumatic fever. All right. And what will be the presentation of PHGN? In PHGN, they will say cola colored urine, and it is a type of nephrotic or nephritic. Can anyone tell me? Yes, it is a type of nephritic syndrome. Okay, so try to interrelate because microbio is just about the factual subject. Get your facts straight, and you are good to go for questions in microbio. All right, coming to Streptococcus agalactiae, that is group B Streptococcus. It is bacillus resistant and it is PYR negative. Okay, so let's just see what is important you have to wear. Group B, mostly in babies, I told you before only. It colonizes vagina, causes pneumonia, meningitis, sepsis, mainly in babies. Okay, now polysaccharide capsule confers virulence, produces CAMP factor which enlarges the area of hemolysis formed by Staph aureus. CAMP stands for the authors of test and not the cyclic AMP. Okay, don't confuse. Okay, don't think about cyclic AMP. Hipurate test positive, PYR negative. Screen pregnant patients at 35 to 37 week gestation with rectal and vaginal swab. Okay, and if they are found positive culture, penicillin ampicillin prophylaxis is very important, or else it will cause meningitis, sepsis, and pneumonia in babies. So very very important. 35 to 37 weeks में testing important है. Hipurate test positive and PYR negative along with bacitracin negative. And yeah, what it causes in babies? Meningitis. So it is not going to affect the females directly. In females, because of the colonization in vagina, you have to check for the culture and see whether it will be spreading to baby, vertical transmission, and it is causing damage to baby. Okay, coming to Streptococcus bovis, gram positive colonizes the gut. Streptococcus galacticus can cause bacteremia and infective endocarditis. I already noted down for you while we were doing the infective endocarditis. Streptococcus bovis or galacticus is for colon cancer associated infective endocarditis. Okay, that's it for Streptococcus bovis. So what was given in Streptococcus bovis? Okay, nothing particular was there for Streptococcus bovis. So it is there only. Let we will see about the Enterococcus species. Enterococcus, gram-positive cocci, Enterococci, E. faecalis and E. fischum are normal colonic microbiota that are penicillin G resistant and cause UTI, biliary tract infection and infective endocarditis. This also I made you write it down for GI, GU procedures के बाद. Another important point is UTI and biliary tract infection. Biliary tract infection very important. They have asked a question with biliary tract infection. Okay, so catalase negative, PYR positive, typically non-hemolytic. They are vancomycin resistant and enterococci are important cause of healthcare. Okay, so enterococci are more resilient than streptococci can grow in 6.5% NaCl. Okay, 6.5% NaCl. If they are talking about this, think about enterococcus. And what are the two species we have? Enterococcus faecalis and enterococcus faecalis. All right, that's it for enterococci. Coming to bacillus anthracis and these are the conditions associated with bacillus anthracis. All right. Okay. It is gram-positive spore forming. Okay, the spore forming rod. Remember, that produces anthrax toxin. The toxin consisting of protective antigen, lethal factor, and edema factor. Okay, these three factors are important. Has polypeptide capsule, polydglutamate, very important. Colonies show halo of projection, sometimes called Medusa head appearance, very important. Both cutaneous and pulmonary anthrax may be complicated by emerging meningitis, not important. But yeah, the three, these three factors, this polydglutamate, along with that Medusa head appearance, very important. And even this pore forming rod. Okay, so let's move forward. Cutaneous anthrax, remember this image, they will ask you about the black Ashka. Okay. Coming to pulmonary anthrax, inhalation of spores most commonly from contaminated animals or animal products, although as a potential bioweapon. Flu-like symptoms that rapidly progress to fever, pulmonary hemorrhage, mediastinitis. CXR may shows widened mediastinum. Widened mediastinum or mediastinitis is very important. Okay. So all these are very important. Also called wool sorter's disease. So wool sorter is very important. If they give you a case with a wool worker, think that the question is asking you about anthrax. Okay. Prophylaxis with ciprofloxacin or doxycycline. All right. So this is what you have to remember for the anthrax. All those that I have told you, that is the only thing that you have to remember. And from this only questions will be asked in UL as well as in NBN. All right. Moving on to Bacillus cereus, another feature of Bacillus gram-positive rod causes food poisoning. Now, the only case that will be given you in Bacillus cereus is reheating of rice, and after that it is consumed. So if the rice is of bad quality or already infected, no matter even if you reach it to 100 degree, 200 degree, no matter how much you hit, the bacteria are going to survive that. Okay, so you can do nothing. What other important point you have to remember here is you have to remember cellulite, a preformed toxin. It is watery diarrhea and GI pain within 8 to 18 hours. Just force survive cooking rice. This is what they are going to give you in the question. Alright. Coming to Clostridia. Clostridia, another important species of bacteria, the gram-positive spore-forming obligate anaerobic route. They can be two types. They have tetanus toxin and botulinum toxin are proteases that cleave SNAP proteins involved in neurotransmission. As I told you, all the toxins and all they have already discussed before the start of bacteria. Okay, and I am again and again telling you, please, do from Sketchy Medical. That is the best resource for microbiome up to date. No matter you are preparing for USMLE, NEET, PG, FMG, anything. All right. The Clostridium tetani and Clostridium botulinum. Pathogen is non-invasive and remains localized to wound site, produces tetanospasmin. An exotoxin causes tetanus. And the important point, tetanospasmin spreads by retrograde axonal transport to CNS and blocks the release of GABA and glycine from Rancho cells in spinal cord. Pretty high yield. Very high yield. Okay. Now, what are the symptoms? In the question, they will give you trismus, that is lockjaw, and sardonicus, and opisthonotus. All these three symptoms will be given. Either they will use the word or they will explain what is happening over here. Okay. Prevent with tetanus vaccine. Treat with antitoxin. Okay, and wound development. So all of this very important. Coming to Clostridium botulinum, produce a heat level toxin that inhibits acetylcholinesterase release at the neuromuscular junction, causing botulism. In babies, injection of spores, example in honey, leads to disease floppy baby syndrome. In adult, disease caused by injection of preformed toxin, that is canned food. So two important case scenario that can be asked to you, either that is consumption of honey and consumption of canned food, or the other word for this is processed food. Okay, this is very important along with the mechanism. This is very important. Botulinum is from bad bottle. Okay, treatment human botulinum immunoglobulin. Okay, human botulinum immunoglobulin. Local botulinum toxin A injections used to treat fecal dystonia, hyperhidrosis, muscle spasms, and cosmetic reduction of facial wrinkles. Okay, another thing. Symptoms of botulinum: diplopia, dysarthria, dysphagia, dyspnea, descending flaccid paralysis, does not present with sensory. So no sensory symptoms will be given in botulinum. Okay, to make sure you know this. All right. Yeah, another thing, the spores that they have asked over here. Okay, these spores. These spores that they have given here, they are found. They are found in soil and rusty nails. Okay, so this is also the question has been asked, and they haven't mentioned it over here. So make sure you know them. Found in soils and rusty nails. And yeah, along with the honey, you have to remember fruit juices. Even in fruit juice, botulinum can be present. All right, so this is all the important point you have to remember from botulinum. Coming to Clostridium perfringens. So Clostridium perfringens produces alpha toxin, lecithinase, a phospholipid. This line is very important. What is alpha toxin? Lecithinase. That can cause myonecrosis, present at the soft tissue capitals and hemolysis. If heavily spore contaminated food is cooked but left standing too long at less than 60 degrees, post germinate vegetative bacteria. Now see, in this, in the UL, only this first line and gas gangrene was given. Okay, nothing else. So we won't be doing anything else. Gas gangrene and alpha toxin, that is lecithin. Okay, coming to Clostridium difficile, produces toxins A and B which damage enterocytes. Both toxins lead to watery diarrhea, pseudomembranous colitis, often secondary to antibiotic use. Often secondary, and in the question, you will say that a child or a young patient was given antibiotics. Okay, he was given antibiotics after some flu or something like that. Okay, now you have to keep this in mind. If they are talking about antibiotic consumption, then what bacteria will be responsible? That is Clostridium difficile. So in the question, either they will use this line, or apart from this, they will say ampicillin or any one of the drug was used. Okay, another thing, there can be toxic megacolon also over here. Diagnosed by PCR antigen detection of one or both toxins in stool, treatment, oral vancomycin or fidaxomicin. Alright, so this is what is important if we are talking about some antibiotic use and after that diarrhea is occurring, think about Clostridium difficile. Okay, so in each and everything I am writing down the case for you so that it becomes easy to remember. And the bacteria in which so many questions have been asked, I am covering wholly. Okay. All this very, very, very important. I'm highlighting it. Okay, so let's go ahead. We have Corynebacterium diphtheriae. This image very important, easy to identify. Gram-positive rods occurring in angular arrangement. Very important line. Respiratory droplet is the spreading. Causes diphtheria via exotoxin endocoated by beta fluorescence. Protein exotoxin inhibits protein synthesis. This is the mechanism. Nothing to understand. Hands down, you have to remember it. Symptoms include pseudomembranous pharyngitis, grayish-white membrane, as you can see over here. With lymphadenopathy, there will be bull neck appearance. Toxin dissemination because myocarditis, arrhythmia. There can be heart problem, there can be pharyngitis, there can be neural problem. So all the problems will be there along with this respiratory droplets, and you will see diphtheria. Okay. Lab diagnosis based on gram-positive rods with metachromate, blue and red granules. Elect test positive for toxin. In UWorld, one question is there regarding this. Okay. And Loeffler media is important. Okay. So this is what you can see in the mechanism as well as what all you need to remember over here. The current diphtheria, again, important. They will definitely give you this image or they will ask you the mechanism over here. ADP ribosilation. All right. Moving to Listeria monocytogenes. Again, this is seen in babies. So gram-positive facultative intracellular rod ingestion of unpasteurized dairy products and cold alimates, transplantation, placental transmission by vaginal transmission during birth. Grows well at refrigeration temperature. Okay, so what will happen is eh, babies consuming dairy products. Okay, and that dairy product has already been contaminated by listeria. Even if you keep it in refrigeration, no effect. Okay, forms rocket tail via actin polymerization that act on that allow this line very important. Listeria ceiling generates pores in the phagocytes, allowing it to escape in the cytoplasm. Characteristic tumbling motility. Now, tumbling motility is very high. Tumbling motility is very high. So make sure you know it properly. Okay? Tumbling motility को highlight कर लो. It's very important. All right. That's it. Nothing else you need to remember over here. Just think about the babies. Okay? They will give you about the babies plus dairy products plus tumbling motility. That's it. All right. Okay. Let's go for nocardia versus actinomyces. Now, see, actinomyces looks like a fungi, but it is bacteria. So, there are many questions in UL where you will be confused thinking it as a fungi and answering based on that. But no, try to remember this image and they will give you. Okay, they are going to give you gram positive. So, if you gram positive, none of the fungi are gram positive, right? So, bacteria is only gram positive. So, think about it properly. All right, let's just see what is important over here. It is found in soil. It is oral found anywhere. It is acidiphile. It is not acidiphile. Aerobe, anaerobe. For this pulmonary infections in immunocompromised. Okay. Cerebral abscess is also important. Causes oral facial abscess that drain through sinus tract, often associated with dental caries, extraction, other maxillofacial trauma, yellow sulfur granules, and treat with penicillin, treat with sulfonamide. Now, one important point, how they are going to give you the case of actinomyces, they will say the tears or secretions from nose or lip, mouth. Okay, they will give you maxillofacial trauma. It means the maxillofacial trauma is here, whereas nocardia is going to occur only in immunocompromised, and that's it. That's how you'll be working out. Sometimes they might give you the same symptoms, and you have to look at the acid fast and whether they are aerobe or anaerobe. Okay, some important point I want you to write it down over here. In actinomyces, there will be infection with jaw pain. Infection with jaw pain. So make sure if there's a jaw pain and infection is there, so you should know. It is catalase positive too. It is urease positive too. Okay. And what? Yeah, in pulmonary infection there will be cavitary lesion. The cerebral abscess they have mentioned. Instead of that, they will give you brain abscess. So don't ever confuse. Okay. So nocardia and actinomyces, one or two questions are there in UL, and straight away the case that they will be asking you is given over here. All right. Coming to mycobacteria, very high yield. Please, in the U world, they have beautifully explained the pathophysio of Mycobacterium tuberculosis infection. So make sure you do that properly. All right. What all is important over here? They are acid fast. Mycobacterium avium is and sucrofalcidium. Now see what they will give you if they want to talk to you about different types of species. So if it is marinum, they will give you aquarium handle, and this one question was there in UL. Okay, cervical lymphadenopathy in children, and avium will be in age. Okay, so keep this all the three species in mind. TB symptoms include fever, night sweats, weight loss, cough, hemoptysis. So fever, night sweats has to be present with cough and hemoptysis. Cod factor creates a serpentine cod appearance in virulent M. tuberculosis strain, activates macrophages, promoting granuloma formation and induces the release of TNF alpha. All this I told you in immuno TB में ये सब करना है. TB में there is involvement of macrophages, there is involvement of TNF alpha, and there is involvement of violent serpentine cord. Okay, cord factor होगा तो serpentine cord होगा. Okay, so this is all very important. So this is the general information. Now let's just see to this. Just try to remember the gone complex. Okay, gone complex very important where it is present. Okay, in primary tuberculosis, what will happen? Either 90% of them will heal by PPD calcification. So you can see यहाँ पे gone complex is seen in the lower part of the lung, in the apex of the lung. Sorry, base of the lung. But when you go for the secondary tuberculosis, if you find a cavity lesion, it is going on the upper lobes of the lung, that is the apex of the lung. Okay, so you should think about this. If the location is on the upper lobe and lower lobe, अगर upper lobe में है, so it is a secondary tuberculosis, and if it is in the base of the lungs, it is the primary infection that is still acting. Sometimes they won't heal, and it will go towards widespread in the body, and this is what known as miliary tuberculosis. All right, and this is all about the pathophysiology that they have given. Let's just see what is important here. PPD positive if current infection or past exposure. PPD negative if no infection. Okay. Interferon gamma release assay has fewer false positives, so this also you won't use. Caseating granulomas with central necrosis and Langerhans giant cells. Okay. Then what you have, TB reactivation risk highest in immunocompromised individuals. HIV also reactivation has predilection for apaches of the lung due to bacteria being highly aerobic. Okay, I told you reactivation है तो यहाँ पे ऊपर मिलेंगे. So this is all just a waste. Don't go to this. But in the UL that they have given about the pathophysiology, please go to that. They have beautifully explained the entire step-by-step product process. Okay, so that's all for the Mycobacterium tuberculosis. Just give me a minute. All right. Coming to the another type of bacteria, we have leprosy, so also called the Hansen disease, caused by Mycobacterium leprae, an acid-fast bacilli that likes cool temperatures. Okay, glove and stocking, loss of sensation. See, leprosy it seems very important, but only one or two questions are there in UL. Whereas if you compare this with other types of bacteria and species, so they have so many questions regarding them. Okay, so leprosy, don't give so much time. Just remember two to three words: glove and stocking, loss of sensation appearance, and another thing is lepromatous and tuberculoid may they won't ask you the types. Okay, they will directly give you any one of the case, and you have to diagnose what type of species it is. Okay, so let's just see. Diffusely over the skin, lion-like faces and communicable high bacterial load, characterized by low cell-mediated immunity with large TH2 response. Okay, tuberculoid may hairless skin plaque characterized by high cell-mediated immunity with largely Th1 type, low bacterial load. Okay, dapsone and rifampin form tuberculoid form. Clofazimine is added for lepromatous form. Okay, what all important point is they are spread through armadillos. Okay, armadillos. And what all is positive? Yeah, in lepromatous there is human to human transmission. Okay, and yeah, in the lion-like faces that you will be seeing, what are the features? Most common will be there is no eyelashes, no eyelashes on the face. Okay, and yeah, another thing on the skin there will be poorly demarcated raised lesions on extensor surfaces of extremities. Okay, so this is what you have to remember in leprosy. That's it, nothing else. So with this, we finish the gram positive bacteria. Now let's move on to the gram negative bacteria. There are so many gram negative bacteria. Let's do them one by one. So and again here you have this algorithm. Take the printout. Check on the wall. All right. Coming to the first and the most important, that is Neisseria. Gram negative diplococci. Gram positive diplococci was Strep pneumoniae. All right. So metabolize glucose and produce IgA proteases, contain lipo-oligosaccharides with strong endotoxin activity. Okay, strong endotoxin activity. Now, it is often intracellular within neutrophils. This is very high yield. This point is very high yield. Okay. Acid production, maltose and glucose. Okay, leave this. Coming to the two types of Neisseria, one is gonococci and other is meningococci. Let's just see what you have to remember here. No polysaccharide capsule, polysaccharide pill. No maltose acid, maltose acid. No vaccine, vaccine is there, but type B. Okay, type B is very important. Sexually or perinatally transmitted via respiratory and oral secretion. Most common among individuals in close quarters, army barracks, college dorm, everything like that. Just a minute. All right. So transmitted via all these different types of secretions and common among the group of people. Okay. What does gonococci cause? Gonorrhea, septic arthritis, neonatal conjunctivitis, and mark my word, this is very not everything. This is so important only, but I am talking about this neonatal conjunctivitis 2 to 5 days after birth. This is very important. 2 to 5 days after birth is very important. Please remember the time. Pelvic inflammatory disease and Fitch-Hughes syndrome. Okay, Fitch-Hughes syndrome. So make sure you know that. Now, what they will give you? They will give you characteristic white purulent discharge. Characteristic white purulent discharge will be given to you. Okay, so that's it. Causes meningococcemia with petechial hemorrhage and gangrene of toes. Waterhouse filtration syndrome. We saw this along with the adrenal crisis. Primary, sorry, not primary. Yeah, it was a type of primary adrenal deficiency. Okay, so make sure you know the difference between them. When it is meningococci, there will be septic shock. There will be septic shock plus there will be rash and there will be adrenal problem. So if this is the case, think about Waterhouse Friderichsen syndrome or think about uh, Neisseria infection. Okay, so this is what is important. Now diagnosis with NAT culture based test of PCR, and this is what you will be seeing. Okay, treatment they don't ask. Okay, so this is what you have to remember in Neisseria. And let me see if any other point that you have to know. Yeah, important point. They have asked in the question, but they have not asked you directly. Let's just see growth on chocolate agar, VP and agar, that is Thayer Martin agar. Okay, so keep these all points in mind, and that's it. Yeah, another thing over here, they can be also be associated with SCD, that is sickle cell disease, and another one is asplenic patient, asplenic. Okay, so all these points for this area very important. Let's move to Haemophilus influenza. So Haemophilus influenza, small gram negative Coccobacilli or aerosol transmission. Okay, Unencapsulated strains are the most common cause of mucosal infection, otitis media, conjunctivitis, and bronchitis. This line is important. Okay. Produces IgA protease. Here also vaccine for capsular type B was introduced. Okay, type B here also and meningococcal also type B. Culture on chocolate agar which contain factors, and this is where they will be ask you to identify. This line is very high yield. High yield में high yield है. Okay. Hemophilia causes epiglottitis. Appearance can be seen cherry red children. Thumb sign on lateral neck X-ray. Thumb sign if they give you think about Haemophilus influenzae. Okay. So here, as we already talked, vaccine contains type B polyribocydyl phosphate. This is also very important, and it is conjugated with diphtheria toxoid protein. Does not cause the flu. Influenza virus does the cause. Okay, don't confuse over here. Okay, doesn't cause the flu. And treatment we'll be doing later. So these 2 points very important along with the presentation. All right. Burkholderia capacia complex. Let's see what they have said. This is the new that they have added over here. So Burkholderia capacia if there is a cystic fibrosis, the one of the most common bacteria that will be acting is Burkholderia. Okay. In the cystic fibrosis, I forgot to mention it down, but I'm mentioning it now. So don't forget it. Okay, let's see what they have given. Aerobic catalyst positive, gram negative rod causes pneumonia in and can be transmitted uh, between patients with cystic fibrosis. Multi-drug resistant infection is relative contraindication to undergoing lung transplant due to association with poor outcome. So just keep this in mind. Burkholderia, I think one question is there in the world. Okay, once again I am telling you, sketchy is the good to go, and micro is just a factual subject. If you know the facts right, micro is a very good to go. Okay, and it is a score booster. All right, moving ahead, Bordetella pertussis. Let's just see what is happening over here. Gram negative aerobic coccobacillus. Virulence factors include pertussis toxin, GI को inhibit करता है, adenylate cyclase toxin and tracheal cytotoxin. Three clinical stage catarrhal, paroxysmal and convalescent. Low-grade fever coryza. Intense cough followed by inspiratory woof. So you know barking cough disease. Barking cough disease is very important. Prevented by this, produces lymphocytosis, treatment, macrolide and TMPA. Now here, some important points you have to keep in mind. Let's just write them down. Tracheal cytotoxin damages ciliated epithelium of respiratory tract. Okay. Another thing, this line very important. Disables GI, adenylate cyclase toxin, and tracheal duct. Very important. Another thing is transmission by respiratory droplets. All right, that's it. Coming to Brucella. Brucella gram-negative aerobic coccobacillus transmitted via ingestion of contaminated animal products. Contaminated animal products, very important. Unpasteurized milk. Okay. Now, unpasteurized milk and contaminated animal products, very important. They will give you a case of uh, poultry farm or dairy farm. Okay. Non-caseating granuloma typically present with undulent fever, night sweat, and arthralgia. That's it. Okay. Not very high yield, but if they ask you about unpasteurized milk contaminated by animated products and all those, so you have to keep this in mind. All right. Legionella pneumophilia. Now, one important thing I want to tell you before we describe Legionella, if in the question sodium levels are less or they mention hyponatremia, आंख बंद करके लीजनेला select करना है. Okay, because this is the only bacteria that will be causing hyponatremia and you should be thorough with this. All right, hyponatremia is very important. Gram negative rod, gram stain poorly, use silver stain. Silver stain is important. Charcoal yeast extract with iron and cysteine, very important. And hyponatremia is important. Environmental water source habit, air conditioning system, hot water tank. Okay, cruise ship and nursing home. And Legionnaires disease, severe pneumonia, often unilateral and lobar, fever, GI and CNS symptoms. Risk factors include older age, tobacco smoking, chronic lung disease, mild flu-like. So see, whatever they give, they should mention hyponatremia. ओके अगर हाइपोनेट्रीमिया मेंशन नहीं है तो ये तो मेंशन होना ही चाहिए चारकोल yeast and silver stain. Okay, another thing that they will either give you swimming pools, they will give you cruises or hot water tank. Another most common word is jacuzzi. Okay, so all this stuff, if they ask you about hyponatremia and all those, think about Legionella. Coming to Pseudomonas aeruginosa, again very high yield bacteria. Motile catalase positive, gram negative rod, non-lactose vomiting, oxalate positive, frequently found in water. Now see all these characteristics, it is only possible when you look at this algorithm. Okay, this is only possible when you look at this algorithm again and again and try to remember lactose fermentation में oxidase में negative fast oxidase positive again aerobic maltose fermentation ऐसा कुछ भी हो. All right, so keep everything in mind and yeah, they will be giving you lots of questions, direct questions आएंगे. Catalase positive, coagulase negative, catalase positive, gram negative, gram positive, everything will be asked. Okay, so please keep these two algorithm print out in front of you and I would highly recommend इसको बार बार देखते रहना. All right, coming back to our Pseudomonas aeruginosa. Pseudomonas aeruginosa, what is you have to remember here, associated with pneumonia, sepsis, diabetes, osteomyelitis, mucoid polysaccharide capsule, or that is externa. Now, externa is important, whereas media was in Haemophilus influenza. All right, non-nosocomial, healthcare associated, hence swimmers here. These two are very important. Okay, swimmers here and healthcare associated are very important. Under thing, injection drug use, hot tub folliculitis. Okay, so all these you have to pick out whatever the case they give you. You should be knowing whether they are talking about the pseudomonas or not. These images are important. Mucoid polysaccharide capsule may contribute to chronic pneumonia in patients with cystic fibrosis due to biofilm formation. Now, one important point, there is a biofilm formation. This biofilm formation is very important. Okay, please keep this in mind. Biofilm formation. Now let's just see what is responsible for infection. That is phospholipase C degrades cell membrane. Endotoxin, fever and shock. Exotoxin A inactivates EFP2. Pigment, pyoverdin and pyocyanin also generates ROI. So each and everything very high yield. Each and every pigment has one question in U1. Corneal ulcers and keratitis in contact lens versus. So this is also very important. Keep this in mind. Moving ahead, erythema gangrenism, rapidly progressive necrotic cutaneous tissue caused by Pseudomonas bacteremia, typically seen in immunocompromised. So treatment you will see later. But remember one thing, I am giving you an example. If this is your hand, these are your hands, and I'm sorry. If these are your hands, okay, if these are your hands and on that you find black spots, not HR. Okay, if in the question they mention HR, then it is going to be bacillus. Okay, they won't if they don't mention HR, then you can go for Pseudomonas aeruginosa. Okay, see each and every line is a question here in UL. And even in NBME, so many questions have been asked. And as I told you, the introduction, you have to focus on that algorithm only. All right, let's move ahead. Salmonella, Shigella, and all those stuff. Let's just see. Now, see how they played with me in the exam. question number 14 was this, question number 15 was this, and question number 16 was this. This is how they asked me, and I was confused कि किसमें क्या difference है. Okay, consecutive question and at the same line. Now I am confused कि इसमें ऐसा था, इसमें ऐसा था, उसमें ऐसा था. I don't know what to do. Okay, so keep, and during the exam you will be scared, you will be in pressure. So you won't even remember कि फर्स्ट ईयर में ऐसा तीन पार्ट में ऐसा कौन सा पहले में क्या था, सेकंड में क्या था. Nothing is going to help you. Okay, so this is very mean and crucial of USMLE. If my video gets viral somehow and if you are using to see this is so bad for you, the book so bad of you. Okay, so let's just see how they ask. They ask some of the features and they ask me consecutively. That was very bad. Okay, so both salmonella and shigella are gram negative raw non-lactose fermented, oxidase negative, and can invade GI tract via M cells of paired packing. Let's just see the differences. We will go differences wise only. Okay, we won't go individual wise. Salmonella typhi, Salmonella species except typhi and Shigella. Let's just see. Humans only, humans and animals, humans only. Hematogenous spread, no hematogenous spread. Yes, yes, no. H2S production. Flagella, yes, yes, no. Virulence factor is Chi capsule. Endotoxin. Infectious dose, large, high, low. Okay. Effects of antibiotics on fecal excretion. Oh, just a minute. All right. The effects of antibiotics on fecal excretion, prolonged duration, shortened duration. Immune response primarily monocyte, PMN, primarily PMN. GI manifestation constipation followed by diarrhea, bloody diarrhea, crampy abdominal pain, bloody mucus stools. No vaccine, and vaccine is present here. Unique properties. Now, on the basis of unique properties, I made the decision what to select what. Okay. So, rose spots on abdomen, fever, GI ulceration, and there was gallbladder colonization. Whereas coming to Salmonella non-typhi, okay, not tough, not typhi. So here it was poultry, eggs, and pet. Okay, antibiotics not indicated. Gastroenteritis. Okay, if they give you gastroenteritis, na, it is mainly because of non-typhoidal salmonella. All right, so make sure you at least pick out one difference from three of them, because if they ask me three of them together, they can ask you also three of them. Okay, so keep this in mind. You should at least pick out one difference from all three of them. Okay, your fingers, flies, food, fishes. Basically, if you see now, everything is going to be same. Now, one unique feature over here is invasion of M cells is the key to pathogenesis. So, if we talk about M cells, think about uh, this Shigella. And in Shigella, you also know one important condition that we discussed, HUS, hemolytic uremic syndrome. We discussed this with TTP in the platelets. So, make sure you can identify by yourself, and that's it. So, it came to me in the exam, so I mark it as very high. You should know the differences between the three of them. All right. How I did was on the basis of symptoms. But sometimes the symptoms were totally gastric. If they give you gastric symptoms in three of them, then you will be confused. Then your game is gone. Then you have to focus on some other features. Okay. So I'll write few features over here for you. Uh, Here there will be pea soup diarrhea. Pea soup diarrhea. Okay, there is pea soup diarrhea. Pea soup diarrhea is seen in Salmonella typhi. Another important thing, it is associated with osteomyelitis. It is associated with osteomyelitis in sickle cell disease. Okay, osteomyelitis in sickle cell disease that you have to focus on. Okay, and that's it. All right, that's it. So keep this in mind. Try to find out one differences. Moving ahead, we have Yersinia enterolytica and what else is there? Okay, this is the extra point that I am writing you. It was given in UWorld. To resistant to cold temperatures, resistant to cold temperatures, bipolar staining. This line was given in UWorld, so you should remember it. Now let's see what else is important. Gram-negative pleomorphic rod, Coccobacillus bipolar thinning already given. Usually transmitted from pet species. Contaminated milk or pork. Can cause acute bloody diarrhea, pseudoappendicitis, right lower abdominal pain due to mesenteric retinitis, terminal everything. Okay, so now one thing is case will be like diarrhea in child plus they will give this. What do we say? Yeah, the child had a pet. And here it will be bloody diarrhea. Remember bloody diarrhea. Wherever you see bloody diarrhea, try to remember where they have given bloody diarrhea. Okay? Because even that is what going to help you to differential diagnosis. Okay? So lactose fermenting bacteria, they have given you what are the bacteria. Just look at them. So basically we finished one more class of bacteria. Now moving on to the lactose fermenting gram negative bacteria. Escherichia coli, very important. E. coli, gram negative indole positive rod, E. coli virulence factors. Now, this line is very important over here because they are going to ask you about the virulence factor, and each of the virulence factor will be responsible for a function. Let's just see over here. Fimbriae, cystitis, pyelonephritis, P. pili. K capsule is responsible for pneumonia and neonatal meningitis. LPS endotoxin for septic shock. Now, again, you will be wondering how you will remember everything else. So that is because of Sketchy Medical. They have given so beautifully. I don't have to give more time to micro. Okay. So let's just see. ETEC, enteroinvasive E. coli, microbe invade intestinal mucosa and causes necrosis inflammation similar to Shigella. Okay, so you can avoid that. Coming to ETEC, produces heat labile and heat stable enterotoxin, traveler's diarrhea, watery, enteropathogenic EPEC, no toxin, Platent villi prevents absorption. Diarrhea usually in children. Okay. And enterohemorrhagic E. coli, EHEC. O157 very important. Transmitted by undercooked meat, raw leafy vegetables, very important. HUS, Shiga toxin causes HUS. Anemia, thrombocytopenia, acute kidney injury. We saw this. Okay, we have saw everything. Dysentery does not ferment sorbitol. Okay, and one important point I wanted to write here is all right. So one important point that I wanted to write here is somewhere they use the word honeymoon cystitis. Okay. And another one is that's it. Yeah. And when they talk about ETEC, they will give recent trip to Mexico. All right. So ETEC का याद रखना. This is important. Okay, my screen just stopped. Stop. Let me just share once again. All right. Okay. So that's all for the H. coli. Now coming to Klebsiella, gram-negative rod intestinal microbiota that causes lobar pneumonia, more common in patients with heavy alcohol or with impaired host deficiency. So most commonly they will give you alcohol abuse. Okay, alcohol abuse. Another thing, dark red currant jelly sputum. Also, healthcare-associated UTI associated with evolution of multi-drug resistance. Okay, so now see. Apart from this, they might give you this either aspiration pneumonia. Why aspiration pneumonia? Because alcoholic patient was there. Okay, so there was aspiration when he was not in his senses. There was aspiration going. Okay, abscess in lungs and liver, current jelly sputum, diabetes mellitus, and alcohol overuse. So these are the cases where they will give you Klebsiella. And remember this image in U world. One question is there regarding this. Okay. Okay. Now one more thing. Klebsiella is immortal. Okay, Klebsiella is immortal. Sorry, there is a Wi-Fi problem going on today. So let's just continue. Campylobacter jejuni. Campylobacter jejuni, we have gram-negative, S-shape with polar flagella. Oxidase positive grows at 42 degrees. Okay. So here, two important points you have to remember about Campylobacter jejuni are they will give you bloody diarrhea plus ascending paralysis. Okay, ascending paralysis. So you know ascending paralysis is seen in GBS. We have discussed this in the neuro. The Guillain-Barré syndrome. It is important. Fecal oral transmission through person-to-person contact via ingestion of undercooked, contaminated poultry or meat, unpasteurized milk, everything. Cook contact with infected animals, dog, cat, pigs, also risk factor. Guillain-Barré syndrome and this. Mostly they will give you this case. Okay. So moving ahead, we have Vibrio cholerae. Okay, it is responsible for causing cholera. We all know. So let's just see what is important over here. Gram negative, flagellated, comma shape, oxidase positive. So all those you have to see from the general info part. Endemic to developed country produces profuse rice water diarrhea via enterotoxin that permanently activates GS. Now in diphtheria we saw that it was inactivating GI. Okay, but here it is activating GS. Now, what are the GI, GS, everything? We saw this in general pharmacology. There are G protein support receptors and there are the subunits of that. Okay, so this some of the bacteria, the virulence factor will be inactivating or activating all these protein receptors. Okay, so you have to remember this. In a question, they will definitely give you which is activating GS, which is inhibiting GI, GS, or whatever else it is. Okay, keep this small information in mind. I'll highlight this for you so don't forget. Increase in CAM. Sensitive to stomach acid, requires large inoculum unless host size decrease in gastric acidity. Okay, now one more thing. They will give you one case over here based on this logic. Okay, now if patient is using PPI, okay, if he's using PPI or then Cetron or any other something like that, so what will happen? Acid will decrease, and if he is infected with cholera or if there is a problem of cholera in his locality, definitely small doses can also be enough to cause cholera in this patient. Okay, because they have used this logic over here. कि cholera का जो inoculum है, it has to be more. Why? Because of the acid present in the stomach. Okay, so because of that, आधे से ज़्यादा cholera के जो organisms है, they die. Okay, so that's why they need large doses. And if the person is already using PPI, acid कम हो जाएगा और large dose में cholera आया, so that will be fatal for him. All right, so you have to remember this logic when you are doing it. They are transmitted via ingestion, contaminated water or uncooked food, raw shellfish. Treat promptly with oral rehydration solution. Now, Vibrio vulnificus. This is another underrated and most frequently asked. UL में दो तीन सवाल है. Usually found in marine environment. Cause severe wound infection or septicemia due to exposure to contaminated seawater. If in the question they give you contaminated seawater, your answer will be Vibrio vulnificus. Okay, that's it. Coming to Helicobacter pylori. Helicobacter pylori, we have curved flagellated gram negative, that is triple positive, that is catalyzed oxidase and urease positive. Okay, so urease produces ammonia, creating an alkaline environment which helps pylori survive in acidic mucosa. Okay, colonizes mainly antrum of stomach, causes gastritis and peptic ulcers. You already know we have done this in the GI pathology. Most common initial treatment is triple therapy. Here, this is very important. Triple therapy is very important. So make sure you know them. Amoxicillin, if sorry, clarithromycin and proton pump inhibitor. Antibiotics cure pylori. Now, bismuth-based quadruple therapy is concerned about macrolide resistance. If in the question they will say that the patient has become to one of the antibiotics, that is macrolide ka resistant ho gaya, so then you can add bismuth also and that will become a quadruple therapy, not a triple therapy. Okay, coming to spirochete. Now spirochete, two important thing, we have to three important bacteria there: leptospira, treponema and borrelia. Only Borrelia can be visualized using aniline dye that is bright or GMs are seen in light microscopy due to size. Treponema is visualized by dark field microscopy. Okay, let's just start with the Lyme disease under very high yield. But let's see. Borrelia burgdorferi, which is transmitted by Ixodes zeatic. This is very important. Ixodes zeatic, very important. I'll again highlight this. Ixodes zeatic, very high yield. Okay, guys. So many questions have been asked. Vector for anaplasma species and protozoa babesia also. Okay, it is also for babesia and anaplasma. But along with that, it is also for Borrelia. Natural reservoir is mouse. Deer are essential to take life cycle but do not harbor Borrelia. Common in northeastern United States, stage 1, stage 2, and stage 3. And you have to remember what all is involved in various stages. They basically won't ask you what stage is involved over. Okay, they won't ask the stages. Bull's eye configuration, erythema migrans. Okay, this is what is given over here. Okay, stage 2, there will be facial nerve, that is Bell's palsy and heart problem. Okay, stage 3, there will be brain problem and neural problem. So you just like this, you can remember. Stage 1 में skin, stage 2 में heart and facial nerve, and stage 3 में brain and peripheral nerve. Okay, facial nerve palsy हो गया ये. Treatment doxycycline is very important. So that's all for the Lyme disease. Okay, so if you get the collective of these symptoms, and most commonly the case will be a forest traveler or forest department official or a hunter or something like that. Found in water contaminated with animal urine. Very important. Okay, if you get this line, straight away go for leptospira. Let's just see leptospirosis. Flu-like symptoms, myalgia, jaundice, photophobia with conjunctival erythema without accident. Prevalent among surfers and in tropics, Hawaii. So you have to look at the location also here. And if they give you prevalent in surfers, think about leptospira anthragan. Coming to whale disease, severe form with jaundice and azotemia from liver and kidney dysfunction, fever, hemorrhage, and anemia. Okay, so this you have to remember. There in whale disease also they will confuse you with the surfers and that also. Okay, but here it will be more severe. Okay, it will be more severe. There will be involvement of kidney also. Okay, so make sure you know the difference between both of them. All right. Coming to syphilis, one of the most high yield and important from so many system point of view. Let's just see. Treponema pallidum treatment is penicillin G. Directly first line with ADA. Primary syphilis is disease presenting with painless chancer. This is what the painless chancer is. I'll show you. Dark field microscopy to visualize treponems in fluid from chancer. So this is how the uh, organism will be visualized, and you will has asked this. Okay, so you should know. Coming to secondary syphilis, disseminated disease with constitutional symptoms, maculopapular rash, important. Okay, condyloma lata, smooth, painless, wart-like lesions on genitals, very important. Okay, now see they haven't given the image of cancer, so I'm showing you in my book. In the old edition, they give is what cancer is. This is what cancer is on the penis. Okay, so I hope you are clear with this. All right. So chancer is also very important. They will give you chancer. The image of chancer will be on the penis. Okay. If chancer is there, think about primary syphilis. If they want to ask you about secondary syphilis, they will give you condyloma lata or maculopapular rash. And another thing that they will give you is VDRL specific confirmed diagnosis with specific test, FTS antibody. Secondary syphilis is systemic. Okay. Coming to tertiary, there will be gammas. Now this is what gammas look like. Okay. Aortitis. There will be problem in the aorta. We saw this aortitis, I think, in thoracic aortic aneurysm, I think. Okay. Neurosyphilis. Neurosyphilis, tabes dorsalis. We saw tabes dorsalis. The dorsal column gone. So proprioception, vibration, pressure sense gone. And Argyll Robertson pupil conflict with accommodation but is not reactive to light. It is also known as prostitute pupil. Okay, and why? Because prostitutes do not react, and as a result, they have given this name. All right. So signs will be Romberg positive, Charcot joint, stroke without hypertension, and for neurosyphilis, you will use this spinal fluid with BDRL and all those stuff. Congenital syphilis present with facial abnormalities such as ragged. Okay, linear scars at the angle of mouth. This is ragged, and this is what is known as snuffle, nasal discharge. Another thing they will ask is saddle nose and Hutchinson teeth. These are what Hutchinson teeth is. Okay, and they will give you mulberry molar, short maxilla, everything they will give you. So, guys, syphilis is very important. You must be able to distinguish between secondary, tertiary, and primary syphilis. Primary is there, they will definitely give you painless cancer. Secondary is there, what like infection, what like lesions will be present in the genitals, maculopapular rash, and another one is condyloma lata, that is what we discussed. This will also be painless. Tertiary may there will be gamas, okay, and it will involve various systems like neural systems, and then we have heart, that is aorta. And in congenital syphilis, you have to look at the teeth, you have to look at the molars, you have to look at the nose and lip. Okay, so सबका अलग अलग features है, and you won't believe me, each one of them is having one question in UL. All right, so syphilis अच्छे से करना. You can skip this, no need. No need. Yeah, one question is there in UL regarding this, so देख लेते हैं. Flu-like symptoms after antibiotics are started due to host response to sudden release of bacterial antigens. Okay, specifically they will ask this in Lyme and syphilis. So remember, antibiotic देने के बाद भी ऐसे flu-like symptoms आ रहे हैं. Think about Jerick-Hatchman reaction. Coming to chlamydia. So in chlamydia, chlamydia cannot make their own ATP. All right. Chlamydia cannot make their own ATP. This is very important line. They are obligate intercellular organisms that cause mucosal. So elementary body and reticulate body. Elementary body and infectious and enters cells via endocytosis, transforms into reticulate body. Reticulate body replicates itself by fission, deorganizes into elementary body. Now this they won't ask. Okay, this is just for your explanation. What they will ask is various symptoms and various species of chlamydia. So this image is so important. Okay. Chlamydia trachomatis causes neonatal and follicular adult conjunctivitis, non-gonococcal urethritis, PID, and reactive arthritis. Another important point: this chlamydia pneumoniae and chlamydia psittaci causes atypical pneumonia transmitted by aerosol. Very important. Chlamydia cell wall lacks toxic peptidoglycan due to reduced midamic acid, rendering beta-lactam antibiotics ineffective. So beta-lactams आप use नहीं कर सकते. Okay. Now, Chlamydia shiitake that we discussed here has avian reservoir, the parrot. In the question, they will give you birds or parrots. Okay. Lab diagnosis, PCR, NAT, cytoplasmic inclusion, reticulate body, very important, seen on GMSA of fluorescent antibody stain smear. Treatment we'll do later, but just remember azithromycin. Okay. Now, one important point I want you to know is the type ABC decay ये जो है ना. So remember one thing. तो ये जो neonatal conjunctivitis है जो chlamydia करता है, it is 1 to 2 weeks after birth, whereas in gonococcal we saw 2 to 5 days after birth. Okay, so don't get confused, and they will ask you the week. So weeks के हिसाब से you have to pick out whether chlamydia है या gonococcal है, because in both of them PID is occurring, urethritis is occurring in both of them. Okay, so उसमें they will ask कि conjunctivitis है, so based on the number of weeks and days that they have presented, based on that you will be doing that. Okay. Another important point over here is lymphogranuloma venereum, small painless ulcers on genitals, swollen painful inguinal lymph nodes that ulcerate. Okay, so this is what you all need to remember in chlamydia. Coming to Gardnerella vaginalis, we saw this, we discussed this a little bit about in the CIN. Now let's see, these are the clue cells that you have to remember. Okay, another important point, pleomorphic gram variable rod. It is gram variable rod. This is very high yield. Gram variable rod, very high yield. Fishy smell, very important. Associated with sexual activity, but not sexually transmitted. Not sexually transmitted. Bacterial vagina also characterized by overgrowth of certain anaerobic bacteria in vagina due to decrease in lactobacilli. So many questions have been asked. Whatever I'm highlighting, so many questions have been asked. Okay. Amine whiff test. Mixing discharge with 10% potassium hydroxide enhances fishy odor. This is important. Another one. Vaginal pH greater than 4.5 during infection. This will help you in differential diagnosing whether it is candida, whether it is vaginalis, or whether it is some other function. Okay, so this is very high yield. So many questions have been asked for Gardnerella vaginalis. Each and every point is having one or two questions. Okay, now see, these are zoonotic bacteria. Now in this, what all are important, I am going to tell you. Anaplasma is important because we have discussed about exotic ticks. Bartonella. Bartonella they have not given. Let's just write about Bartonella. Bartonella Hensley. Okay. Now, whenever they want to ask you about Bartonella, they will always say cat. They will always say cat scratch disease. Okay. Now, cat scratch disease. The case will be there were scratches seen on body. Okay. And the patient will say he or she owns a cat. Okay. Now, what will be the symptom? There will be axillary lymph node involvement. Okay. Immunocompetent, fever, chills, red rash. Okay, so this is very important, and so many questions have been asked for catch disease, and this case have been given. Okay, and another important point that you need to remember here is axillary lymph node involvement. If they say that the patient owns a cat and there is a lymphadenitis seen in the axillary part, think about Bartonella. All right, let's discuss others. Borrelia we did, Brucella we did, Campylobacter we did, Chlamydia psittacis we did, Coxiella we'll discuss ahead, Ehrlichia we'll discuss ahead, Francisella tularensis. If in the question they give you rabbit, this is your answer. Okay, in your world rabbits have been given and this is your answer. No need to do anything else. Okay, Leptospira we did, Mycobacterium leprae we did, Pasteurella multicoda. Now here they will give you dog bite. They will give you dog bite. Okay. Mostly they will give you dog bite. Your answer will be this. Rickettsia will do after this. We'll do after this. After this, we did this. Yersinia pestis. If Yersinia pestis in the question they have given rats and prairie dog, think about Yersinia pestis. Now, 1 minute, let me tell you one point about Yersinia pestis. Yeah. So in the Yersinia pestis, they may say rodents also. It is also known as bubonic plague. Bubonic plague. And that's it. Okay, so just remember rodents and Yersinia pestis. So all of them except from Pasteurella multicoda and this Franciesca turacenis and Bartonella and Yersinia pestis. That's all we have done. Okay. So yes, remember one word for each bacteria. All right, moving ahead. Last page for the bacteriology. Rickettsial disease and vector-borne disease illness. Let's just see. Treatment directly they have given doxycycline. Let's just see. Rocky Mountain spotted fever. Vector is tick and rickettsia rickettsii. Despite its name, it occurs in South Atlantic states, especially North Carolina. Now see, though we haven't been to US, though you don't know the US geography, but US geography plays a very important role while solving microbiome because they have given in bacteria 2-3 cases, but based on the location. In fungi, there are so many cases based on the location. Okay, so the location has to be clear, and in the first year itself, in the next page, while doing the fungi, they have given this. Okay, so this is important, and just try to remember where are Rocky Mountains and where are North Carolina and everything. Okay, now important line over here. Rest starts at wrist and ankles and then spread to trunk, palms, and soles. Very important line. Okay, they will give you in this question. Classic triad is headache, fever, and rash. Palms and soles rash is seen in Coxsackie virus, hand, foot, and mouth disease, Rocky Mountain spotted fever, and secondary syphilis. Okay, so if they are talking about rickettsii, think all this in mind. Coming to typhus, endemic, epidemic, Rest starts centrally and stretch out. Now see, here it will start on trunk and then it will stretch out. Okay, so this is how you are going to differentiate between the two of them. All right, coming to rash, L-ristosis that we read the name before, vector is thick, monocytes with morule, mulberry-like inclusion, very high yield, very high yield. Make sure you know this properly. Okay, and the name and the image, they will give you this image. You should be able to identify. Coming to anaplasmosis, anaplasma vector is thick, granulocytes with morule. Just these two images, try to remember. Okay, and here vector is thick, but the carrier is actually deer. We saw that, right? We saw that in Borrelia. Where is that? Ixodes zeatic. Okay, so here also Ixodes zeatic anaplasma. Alright, coming to Q fever, Coxiella burnetii, no arthropod vector. Bacteria inhaled as aerosols from cattle or sheep amniotic fluid. Okay, so in the question, they will give you a farmer or a cattle handler or a sheep or anything, cow or anything will be given. Think about, and if the patient is having pneumonia, headache, or flu-like symptoms, think about Coxiella. Okay, it has no rash, no vector, and causative organism can survive outside in endospore form. Okay, so just think about all of this. One word. These are one word direct question. Coming to Mycoplasma pneumoniae, classic cause of atypical walking pneumonia. So your important line is diffuse interstitial infiltrate. Diffuse interstitial infiltrate, very important. Occurs in less than in young patients. Mostly they will give you military, prisons, college, etc. Okay. Now another thing. It is not seen on gram stain. It is pleomorphic bacterial membrane contains sterols for stability. Sterols very high yield. CXR appears more severe than patient presentation. High titer of cold agglutinin, IgM, which can agglutinate RBCs. Okay, and can cause atypical variant of Steven-Johnson syndrome. So all these lines are very important. Sterols is important. IgM wala is important. HGS is important. Okay, that's all for Mycoplasma pneumoniae. And one important point you have to remember, they have no cell wall. If they have no cell wall, so gram stain nahi hoga and all those stuff you have to keep this in mind. All right. So this is what they are talking about, and that's with this we finish our bacteriology. We'll start with mycology. Just give me 5 minutes. All right. So 5 minutes break. Mycology start करते हैं. All right, let's begin. Mycology. Systemic mycology. All of the following can cause pneumonia and can disseminate. All are caused by dimorphic fungi, cold, mold, heat, yeast. Okay, this is the hint. Cold, mold, and if it is yeast, so it is heat. Only in the high temperatures it will be yeast. Okay. Only exception is crocodile, where which is ferule, not yeast. Okay. So yeah, they will focus on and they will try to confuse you. They will give so this hint is very important. Keep this in mind. All right. Moving ahead. Histoplasmosis. First of all, try to remember all the okay. Now, in this part of microbiology, you have to remember the geographic locations as well, along with the characteristics, organism, and everything. Okay. So geographic locations is this. In the question, they will give you this. And once you figure out this location, your diagnosis is made. Okay. This location is very, very high yield. You have to do it. Another thing. What will be the pathologic features? Macrophages filled with histoplasma, smaller than RBC. In blastomycosis, same as RBC. Coccidioidomycosis with endospores of so much larger than RBC. Okay, and over here that is the captain's wheel. So this one word is very important. Another word, broad-based budding, spherule. Okay, so this small word very important. But the first thing, location. अगर आपने location कर लिया, you're good to go. Coming to the unique signs that we have to remember over here is palatal tongue ulcers, splenomegaly, pancytopenia. All these are common. Okay. Coming to blastomycosis, there is dissemination to bone, skin, lesions, etc. Okay. Coming to coccidiomycosis, all those will be same, but one problem. In coccidiomycosis, they will give you a case whether it is in desert or earthquake areas. Okay, so they will give you this case and you have to pick it out कि कौन सा होगा. Even they will give you like dust exposure, that is archaeological excavation. All right. Coming to histoplasmosis में देखते हैं. Histo hides within microwave saturation with bird or bat dropping. Histoplasmosis में they will give you a case of bat dropping. Okay, so this is important. In blastomycosis, you will be have to remember budding, broad-based budding. Okay, coccidiomycosis में earthquake or desert or dust वाले areas. Okay, and last paracoccidiomycosis में they will give you location Latin America, very easy to understand, and captain's wheel, much larger than RBC. Okay, so that's all. That's all you need to remember. One important point over here: mucocutaneous lesions in gum. Okay, and another thing is on radiography, they can show cavity or else nothing. Okay, this is about coccidiomycosis I'm speaking about. And in blastomycosis, on chest X-ray, they will show patchy infiltrate in alveoli. Patchy infiltrates in alveoli. All right. So these are the points that you have to figure it out. And treatment for all of them is amphotericin B. Okay. So done with the systemic mycosis. Let's move ahead. Opportunistic fungal infection. Opportunistic fungal infection means the body is already infected with some infection, and again the fungus are acting there. All right. Let's just come to the most commonly asked question, that is Candida albicans. Candida albicans, dimorphic forms, pseudohyphae, and budding yeast at ulta. So here it is ulta. Okay. You can see here yeast at cold temperature, whereas in the systemic yeast at high temperature. Okay, so this is one under form. Systemic and superficial fungal infection causes oral and esophageal crust. Oral and esophageal crust. We'll see one by one all the image. Okay. Immunocompromised में vulvovaginitis, diaper rash, infective endocarditis, disseminated candidiasis, especially in neutropenic patients. Chronic mucocutaneous candidiasis. Now, what is important? I am going to highlight it. Oral and esophageal thrush, immunocompromised, diaper rash, and disseminated candidiasis, especially neutropenic patients. Very, very important. And chronic mucocutaneous candidiasis. So, all these are very important. Treatment, you have to remember oral fluconazole. Nystatin is very important. And that's it. Or you can, treatment will be looking ahead, but nystatin is very important. And yeah, let's just see the image now. Oral first. And another important point I want to remember, in the exam they will give you the images like this also, so you have to keep this in mind. Okay, images like this also you have to see. It is dimorphic, form pseudohyphae, yeast and the germ tube, the tree, everything they have given over here. Same image will be asked in the exam. Okay, candida very, very high yield along with aspergillus fumigatus, very, very high yield. So make sure you know them. Okay, and one important point I want to tell you over here is esophageal thrush will be seen in CD less than 400. It can be catalase positive. Only fungi that is catalase positive. Another point was no vaginal infection after 4 pH. Okay, so pH greater than 4 में इसका कोई vaginal infection नहीं होगा. Okay, whereas in Gardnerella vaginosis, we saw in pH less than 4.5. Let me just check. Okay, so Gardnerella में if pH was greater than 4.5, only then Gardnerella was there. But here, if it is greater than 4, Candida infection won't be there. Okay, so this is how you will be differentially diagnosing it. So that's all about Candida albicans. Let's move towards the Aspergillus. Now, Aspergillus, septate hyphae that branch at 45-degree acute angle. 45-degree acute angle. Okay. Invasive aspergillosis in immunocompromised, especially those with neutrophil dysfunction. Okay, neutrophil dysfunction दोनों में है. So you have to pick out other features also. Okay, because aspergillus is catalase positive. This is also catalase positive. Can cause aspergillomas in pre-existing lung cavities. This is very, very high yield. Okay. Some species of aspergillus produce aflatoxin that is responsible for hepatocellular carcinoma. We already discussed this in liver. So see, this is what aspergilloma looks like. All right, very, very important. And this is ABPA, hypersensitivity response to aspergillus growing in lung mucus associated with asthma and cystic fibrosis may cause bronchiectasis and eosinophilia. Very important. All right, let me see any other point that you need to remember. Can spread to paranasal sinus and can cause necrosis of nose. Okay, this is one important point. That's it. All right, that's it. But each and every point that I've circled it, very important. So many questions on opportunistic fungi there in Google and even in NBME and even there is exam. All right. Coming to Cryptococcus neoformans, one important thing and the beautiful thing about Cryptococcus neoformans is you can easily identify them. So many questions are there. So many questions in UL with this image. Okay, so remember this image. Now let's come see what is important. Narrow budding, heavily encapsulated yeast, not dimorphic, PS positive staining, found in soil, pigeon dropping. This is where you will diagnose it. Acquired through inhalation with hematogenous destination. Also, clear halo. India ink stain, clear halo, and mucomycin is red in a capsule. This is also very important. Alright. Latex agglutination tech detects polysaccharide capsular antigen and is more sensitive and specific. Causes cryptococcosis which can manifest with meningitis, pneumonia, encephalitis. Soap bubble lesions in the brain. Okay, so meningitis is also caused by Cryptococcus neoformans. All right, so this is what looks like uh, in the mucocharmine stain, and that's it for the Cryptococcus. This image is very important. and this information that I have circled very highly. Mucurrent rhizophus, mostly they will ask you with DKA or diabetes. Okay. Irregular, broad, non-septate, hype branching at wide angles. So this is what wide angles is. Okay. This is what it will look like. Mucormycosis rhizopus. Okay. Like diabetes होने के बाद जो हो रहे थे, even in the COVID. Okay. Even in the COVID, this was the problem. You must have seen because of steroids and fungal infection were occurring, and you can see, you must have seen about it. Okay. The causes mucormycosis mostly in patients with decay or neutropenia. Inhalation of spores, fungi proliferate in blood vessel walls, penetrate cerebrum fluid, and enter brain. Rhinocerebral frontal lobe abscess, headache, facial pain, black necrotic eschar on face. So this is what they will give you. All right. So yeah, based on that, we have finished our opportunistic fungal infection. Each and everything is very important here. You can't like manage to leave anything. Okay, you can't take risk. Even in the systemic microbiome, each and everything is very important. And believe me, fungi are more easy than bacteria. One line you have to pick out, directly the answer will be solved. Okay. Coming to pneumocystis jirovecii, very important because here what you have to remember is ground glass appearance. Diffuse bilateral ground glass opacity is on chest cell. Let's just see. Diffuse interstitial pneumonia, yeast like fungus, which is a protozoan. Most infections are asymptomatic, etc. Did not. Yeah. Here they will ask you in the question how it is diagnosed. So diagnosed by broncho alveolar lavage or lung biopsy. In the question they say broncho alveolar lavage. Okay, if in the question they say broncho alveolar lavage, think about pneumocystis jirovecii. This shape is seen on metamine silver stain on lung tissue or with fluorescent antibodies. Very easy to diagnose. TMP SMA, and just think about all of this. Okay, very easy. बस ये stains देख लेना. Diffuse interstitial pneumonia and this. Coming to sporosis kenki, causes sporotrichosis, dimorphic fungi. Remember this image. X is at a cigar shape which at 37 degree in human body and a hyphae with spores in soil. Okay, when spores are dramatically introduced into skin, typically by a thorn, so they will give you in a gardener. Okay, they will give you in a gardener and rose thorn they will give you. Okay, causes local pustular ulcer with nodules along draining lymphatics, and that's it. Remember this. All right, so see in the fungi, you just have to pick out one word and then you are good to go. With this, we finished mycology. Okay, so guys, still time is there. Let me finish parasitology also because tomorrow we have to do virus and antimicrobial, and antimicrobial is very big. Okay, so let's just think about the parasite. Let's just finish parasitology also today. All right, so Giardia. Let's just discuss about Giardia. Oh, Giardia lambda. Giardia is bloating, flatulence, foul smelling, non-bloody fatty diarrhea. This is very important. Okay, foul smelling fatty diarrhea very important. And in the question they will say you went camping, or a group of children or a young patient went camping. There was they drank water, and in the transmission was due to cyst in the water, and the symptoms were foul smelling diarrhea. Okay, diagnosis multinucleotide trophozoites or cysts in stool, and treatment is metronidazole. So this is how Giardia will look like. And guys, remember the same image was asked to me in the exam. So in this also image is very important. Okay, so Giardia lambia done. Let me see other important thing. And nothing else. Just remember IgA is associated with Giardia. We did this in the immunodeficiency disorder. Remember? So वहाँ पे भी हमने Giardia का किया था. Okay, so just make sure you know that. Entamoeba histolytica, very important. Few important lines are anchovy paste, right upper quadrant pain, flask shaped ulcers. Okay, it is bloody diarrhea, liver में pain है, right upper quadrant है तो liver होगा, flask shaped ulcers, anchovy paste, you have to remember. Again, cyst in water. Now see, trophozoites with engalplasticity or cysts with up to 4 nuclei in stool. Treatment metronidazole, ये treatment आपको याद रखना ही पड़ेगा. Okay, let's just see the image. This is what you have to remember. You have to remember the images. Same images will be coming to you in the exam. Coming to cryptosporidium. Cryptosporidium में आपको आएगा age, plus diarrhea, most common. Okay, and in the question they will say uh, which is in water and acid fast chain. तो ये तो है ही, आपको पता लगाना ही है. So in the question what they will give you the entire city was infected. Okay, so in the treatment they will say prevention by filtering city water supply. Nitazoxanide also important. Okay, and another thing they haven't given here, yeah, who sites on acid fast chain. This is important. Who sites on acid fast chain is important. Another thing, yeah, in Entamoeba histolytica, anal sex also increases the transmission. That's it. And these oocytes that they have given over here, they releases four motile sporozoites. Okay, so all these points very important for GIT infection. Moving ahead, we have CNS infection. Toxoplasma. So this will be mostly in pregnant and immunocompromised patients. All right, so let's just see what is important over here. All right, let's just see. Immunocomponent mononucleotides like symptom. Negative hydrophil antibody test, reactivation in 8, brain abscess usually seen as a multiple ring enhancing lesion. Now this very important. Multiple ring enhancing lesions on MRI because ahead there will be neurocystic orchids and there are so many other things. So everywhere you have to figure out कि brain में कौन से lesions किस में दिख रहे हैं. Okay, so make sure you know that. Now coming to congenital toxoplasmosis, classic triad of chorioretinitis, hydrocephalus, and intracranial calcification. Okay, so most important case they will give you is pregnant patient with cats. Pregnant patients with cats. This is one case. Cyst in mate most common. Now see in the options they will give you both of them. Pregnant patients with cat plus cyst in mate. Your answer, your priority will be cyst in mate. Okay, cyst in mate very important. When a pregnant female eat the cyst in mate, uh, this is the most common one. Okay, oocytes in catfishes. All right, biopsy में tachyzoid दिखेगा and treatment is you have to see. And the CD4 plus should be less than 100. This is very high yield. Okay, no problem. At the end, when you finish telling all the virus, bacteria, everything, at the end they have given a summary of all the symptoms. Just go to them. I'll show you after you finish virus. Don't worry. But before that, yeah, you should remember this. Okay. Now, one more thing. In the question, they will ask how you will differentiate it from lymphoma. So you will say brain biopsy used to differentiate from lymphoma. Okay. Another thing is that's it. Okay. So just remember all the symptoms given. Congenital also in the small baby also it can occur. And transmission remember. And CD4 less than 100 is very important for toxoplasma. Like let's see the image. So this is what multiple ring like enhancing lesion, and this is what the image. See guys, this image also you have to remember. Everything you have to remember on the images. Same images will be popping to you in the UL as well as in the exam, in the NBME, everywhere. Alright. Coming to Naglera fowleri. Naglera fowleri, they will give you swimming in warm or fresh water. Directly case they will give you. Okay. Amoebas in CSF. So this is what amoebas in CSF looks like. And amphotericin B. That's all you have to remember. Rapidly fatal meningoencephalitis problem over here. Okay. So along with this, they will give you diagnosis by lumbar puncture. Another thing, instead of this, they will give you affects the patients who are involved in water sports. Okay, so water sports important. Alright, that's it. Naegleria fowleri. Water के related कुछ आया? Naegleria fowleri. Coming to trypanosoma brucei, African sleeping sickness, lymph nodes, recurring fever. Okay, and it can be coma also. say fly, a painful bite, and trypomastigote in blood smell. This is how trypomastigote look like. Suramine for bloodborne or melarsoprol for CNS penetration. Remember this. Alright, so see everywhere there is one word you have to pick it up. Okay, one word, and that's what is going to help you in the diagnosis. Okay, moving on, plasmodium. Now, plasmodium, you must have seen so many questions regarding the treatment and various species. Let's just see. Plasmodium, hematologic infections है, malaria, cyclic fever, headache, anemia, splenomegaly, hypolacemia, everything severe. Okay. Anopheles mosquito is responsible. And if sensitive, chloroquine. If resistant, mefloquine, doxycycline, or atovaquine. If life-threatening, use intervenous quinine or artesunate. Test for. So see, entire treatment they have given here. So now you don't have to worry about the treatment. Okay. Let's just see the various types में कौन सी differences है. So if they are talking about malaria, 72-hour cycle. Vivax oval, 48-hour cycle. Falciparum, it will affect the brain. If we talk about falciparum, it will affect about brain. Okay, and it's the most severe one. All right, capillaries in brain, everything. Blood may be tropocyte ring within RBC, crescent shaped gametocyte. This is what crescent shaped gametocyte looks like. So these images are new images. It wasn't given in the old edition, so you can take the screenshot if you want. All right. In bival oval, there were blood may be trophocyte and Kupfner stifling, small red granules within the RBC. All right. Coming to this, trophocyte with headphone shape within RBC. Headphone shape. Okay. So make sure you know them. Headphone shape. And if you're talking about Vivex and oval, think about remark going to target lymphocyte and how you will decide the Vivex and oval है frequent based on the cycle. They will give you the question. Okay. Falciparum में cycle नहीं देंगे, but they will say brain involvement. If brain involvement is there, falciparum is the answer. And let's wait. I've written something, so let me just see. And yeah, in the UL, just read malaria life cycle for once. Okay, पढ़ लेना. Okay, so many questions have been asked based on the life cycle more than the disease. Okay, so एक में तो ये आएगा hypnozoids को मारना and all those stuff everywhere. It is given very beautifully in UL. So instead of explaining me here, when you solve the question in UL, please be good to go. All right, let's just move ahead. Babesia. Fever and hemolytic anemia predominantly northeastern and north central. Asthenia increases get infected RBC. Now see, blood may ring form and Maltese cross. See, this is what is remember. This is what Maltese cross and this is what ring shape. Ring shape, it will confuse you with the signet ring. Okay, where is signet ring thing? Where is signet ring thing? GI adenocarcinoma. Alright, so confuse नहीं होना है. यहाँ पे भी एक्सोडस टिक आएगा जो कि बोरेलिया एंड एनाप्लाज्मा दोनों के लिए आता है. ओके, बेबेसिया इज इजी बट मलेरिया प्लीज डू इट फ्रॉम यूवल. ओके, एक बार यूवल से देख लेना. कमिंग टू प्रोटोजोआ अदर, देयर इज विसरल इन्फेक्शन. Visceral infection, Trypanosoma cruzi. Trypanosoma cruzi, we have done this in Chagas disease and in Echinacea cardia. Okay, we did this in Echinacea cardia. Let's just see again. Dilated cardiomyopathy, toxic megacolon, mega esophagus. Okay, this is the South America is important over here because in South America, this kissing bugs are seen, triatomine insect. Defecates around the mouth. Okay, so fecal transmission into bite side or mucus. Okay, very important. We are also trypomastigote. Okay, and remember the drug. So see, one line is seen everywhere. One line. Leishmania species. Visceral leishmania, that is Kala Ajar. Spiking fever, hepatosplenomegaly, pancytopenia, cutaneous skin ulcers, sand fly. Okay. Macrophage containing a mastigote. A mastigote. Look at the image. Yeah. Sexually transmitted में trichomonas vaginalis. Now important over here is vaginitis, foul smelling and greenish discharge. If it is greenish discharge, straight away trichomonas. And the important thing, do not confuse with Gardnerella, gram variable bacterium, not necessary. Sexual cannot exist outside human because it cannot form cysts. Trophocytes on wet mount punctuate cervical hemorrhage. Strawberry cervix very important. Strawberry cervix very important. Green discharge very important. Maternal for patient for partners. Okay. Now one more thing. In the question they will give you how you will prevent it. How to prevent. So answer will be give metronidazole to both patient as as partner. Okay. This has been asked in NBME and UL. So you should know this. Okay. See again. One image, one word is what going to help you over here. All right. So make sure you know them properly. And here also you have trophocytes on wet mounts. This is how they are going to look. So images are very important in the actually mycology and parasitology part. Image देख के आप आधा क्वेश्चन सॉल्व कर सकते हो. Stains देख के आधा क्वेश्चन सॉल्व कर सकते हो. Insect का नाम देख के आधा क्वेश्चन सॉल्व कर सकते हो. All right. So with this, we are done with this. And the one last part of the parasitology, that is nematodes, and this becomes a little difficult to diagnose. Let's just see. Enterovirus vermicularis. First, actually, you remember the name and the local name also. Okay. Causes anal pruritus, diagnosed by seeing egg via a tape test. If in the question they give you tape test, think about pinworm. All right. Remember the treatment as well. Ascaris lumbicoid, giant roundworm, may cause obstruction of ileocecal valve, biliary obstruction, intestinal, everything they will give you. Fecal oral nobicoated overlap seen in fishes. So here what was important is Ascaris lumbicoid में ileocecal, biliary tract obstruction. All right. Now see, one common feature in the nematode here will be from the blood, from the feces. Okay, they will go into your blood. From the blood, they will go into your lungs. From lungs, they will go into GI tract. From GI tract, there will be larva in stool. Okay, so all this very important. Strongyloid, that is threadworm. Duodenitis, pulmonary, cutaneous, hyperinfection caused by autoinfection. Okay, that's it. Larva in soil penetrate skin. Rhabditiform larva. This is what important here. Rhabditiform larva. All right, rhabditiform larva is important. The larva in soil, it is important. Coming to ancylostoma, that is hookworm, causes microcytic anemia. We saw this. And if it is cutaneous, it will cause pruritic serpingeous rash. Pruritic serpingeous rash easily seen. This is what is serpingeous rash. Okay. Larva penetrates skin from walking barefoot on contaminated beach and soil. This is also very important. All right. Coming to trichinella spiralis. Now, if any worm is associated with the muscles, okay, muscles के साथ अगर कोई associated हो रहा है, think about trichinella. Okay. Muscles is very important. Undercooked meat, especially pork. Okay. So pork खाने के बाद there is an infection in the muscle or worms in the muscle, worm infection in the muscle area. Think about trichinella. This is the case. Okay. Very important. Myositis mark कर रहा हूँ because it is muscle. Okay. Rest all everything is common. And I think one important point was there. I'm forgetting why. No, nothing I have covered actually. All right. Nothing. Okay. Last one. Trichuria, trichuria, often asymptomatic low stools, anemia, all that stuff. Okay. So see, in this five are important. You can skip trichuria. Coming to tissues, Toxocara canis, visceral larva migraine. Okay. So migration into blood, inflammation of liver, eyes, CNS, heart. Toxocara canis में क्या था? Yeah. Transmitted by ingesting food contaminated with dog or cat feces. Dog or cat feces, same as toxoplasma. The name is resemble Toxocara canis, toxoplasma. So based on that, you can think about it. Onchocerca volvulus, blindness. Okay, there will be black side. Female black fly is important for this. Loa, swelling in skin, not necessary, but just give a read. Wucheria bancrofti. Lymphatic filariae very important. Lymph nodes को invade करेगी. Female mosquito. That's it. And yeah, in lower they can ask you horse, mango, or deer fly. So this is not pretty high yield except Wucheria pancreatic. Okay, but once again look at all the images so that you are good to go. And see, ये दो तो ऊपर के ही है, ये दो तो ऊपर के ही है. All right. So make sure parasitology may you should be able to identify the organism, and it is very important. All right. Moving on to cestodes, that is tapeworms. Cestodes में क्या है? Tinea solium, intestinal tapeworm, and cystic orchid. It will cause neurocystic orchid. Okay. Ingestion of larva ancestral in undercooked pork or ingestion of eggs in food contaminated with human feces. All right. Remember the drug. So neurocystic orchid looks like this. See, these are neurocystic orchid. Okay, you should be able to know the various MRI images of the brain, and this is what tinea solium looks like. All right. Coming to diphyllobotium latum, vitamin B12 deficiency is very high yield, and another one is it will cause megaloblastic anemia. Ingestion of larvae in raw freshwater fish, very important, very important. Okay, that's it. Echinococcus granulosus, hydrated cyst, egg cell calcification in liver, cyst rupture can cause anaphylaxis. This line very important. Very important. In UL also questions are there. Okay, this is what cyst look like, and this is what a cyst look like. Hydrated cyst. Ingestion of eggs in food contaminated with dog, fishes, or sheep. Sheep are the intermediate host. Okay, treatment you have to remember yourself. So this is all one liners, and remember the MRI images. Remember all the images. Okay, coming to trematode, that is fluke. Schistosoma associated with I think urethral cancer or bladder cancer. Okay, remember these two. First one, Schistosoma mansoni and Schistosoma hematobium. Let's just see both of them. All right. S mansoni, egg with lateral spine, all those stuff. And what is important over here is, yeah, egg with lateral spine, egg with terminal spine. Okay. And hematobium is what's responsible for causing you the bladder squamous cell carcinoma. This they won't ask you much, but yeah, how they will ask is snails are intermediate host and contaminated fresh water, swimming or bathing. Okay, basically they will give you about bladder cancer only, not anything else. All right, remember this images. And yeah, what is the case history over there? A person coming from Middle East. Okay, person coming from Middle East is what you will be given. Coming to clonosis sinuses, biliary tract infection, pigmented gallstone. This is the thing. If there is anything related to biliary gallstones or gallbladder, think about clonosis sinuses and the cooked fish. That's it. All right. So I think that's it. And let's just see what else we are left. Yeah, Sarcoptes scabies. This both was asked in UL, but they have been asked in MBME or even in the exam. So let's just see scabies. Might burrow into stratum corneum causes scabies. Pruritus worse at night and serpentine burrows often between fingers and toes. All right. Common in children, crowded population. Transmission to skin contact via fomite. Treatment you have to remember. So scabies is important. I think NBME had one or two questions regarding scabies. Scabies is important. Particular human, they just remember one thing, they are head lice. That's it. Head lice. Okay. And nothing else. Bed bugs is important because not important because one question was there in the UL. So if they are asking about bed bugs, think about Cymex, Leticularis, and Climax. Okay, infested hotels and everything. All right. So this is what the hint is given about the parasite, and with this we finish parasitology. Between today, so today we finish bacteriology, mycology, parasitology. Tomorrow we'll do virology and antimicrobiology. All right. So with this we finish our today's class. Hope to see you tomorrow. Tomorrow is the last class, and I want maybe everyone can join, and that's it. All right. I take today's leave. The class is over.